Manual handling and procedure. Safety interview. Questions and answers. Question: what is manual handling? Manual handling involves any activity that requires a person to use force to lift, lower, push, pull, carry, or otherwise move, hold, or restrain an object. It is a common cause of workplace injuries, particularly when tasks are performed incorrectly or without proper precautions. Question: common risks associated with manual handling. 1. Musculoskeletal disorders, MSDs, strains, and sprains, for example, back, shoulders, arms. Hernias, tendinitis, chronic pain or long-term injuries. 2. Acute injuries, cuts, bruises, or fractures from dropping objects. Crush injuries from handling heavy or awkward loads. 3. Fatigue and overexertion. Repetitive manual handling tasks can lead to fatigue, increasing the risk of accidents. 4. Environmental factors. Slippery floors, poor lighting, or confined spaces can increase the risk of injury during manual handling. 5. Poor ergonomics, awkward postures, for example, bending, twisting, or reaching, can strain the body. Question: what are the key principles of safe manual handling? 1. Plan the task, assess the load. Is it too heavy, bulky, or awkward to handle safely? Check the route. Are there obstacles, stairs, or uneven surfaces? Determine if mechanical aids, for example, trolleys, forklifts, can be used instead of manual handling. 2. Use proper lifting techniques. Position your feet. Stand with feet shoulder width apart for stability. Bend your knees. Use your leg muscles, not your back, to lift. Keep the load close. Hold the load as close to your body as possible. Avoid twisting. Turn your feet instead of twisting your spine. Lift smoothly. Avoid jerking or sudden movements. 3. Team lifting. For heavy or awkward loads, use team lifting techniques. Ensure all team members communicate and coordinate their movements. 4. Reduce the load. Break down heavy loads into smaller, manageable parts. Use tools or equipment to assist with lifting or moving. 5. Maintain good posture. Avoid bending, reaching, or twisting while handling loads. Keep your back straight and shoulders level. Question: what are the employer responsibilities? 1. Conduct risk assessments. Identify manual handling tasks and assess the risks. Implement controls to reduce or eliminate risks. 2. Provide training. Train employees in safe manual handling techniques. Offer refresher courses to reinforce good practices. 3. Provide equipment. Supply mechanical aids, for example, trolleys, hoists, conveyors, to minimize manual handling. 4. Design the workplace. Ensure workstations are ergonomically designed. Store heavy items at waist height to reduce bending and reaching. 5. Monitor and review. Regularly review manual handling tasks and update risk assessments. Encourage employees to report discomfort or hazards. Question: what are the employee responsibilities? 1. Follow safe handling techniques and use provided equipment. 2. Report any hazards or discomfort to supervisors. 3. Avoid rushing or taking shortcuts that could lead to injury. Question: what are the manual handling regulations? 1. UK. The Manual Handling Operations Regulations 1992 require employers to avoid hazardous manual handling where possible and assess risks when it cannot be avoided. 2. Australia. The Work Health and Safety (WHS) regulations outline duties to manage manual handling risks. 3. USA. OSHA, Occupational Safety and Health Administration, provides guidelines under the General Duty Clause to ensure safe workplaces. Question: what are the examples of manual handling tasks? 1. Lifting boxes in a warehouse. 2. Moving furniture during office relocations. 3. Pushing or pulling carts in a retail environment. 4. Carrying tools or equipment on a construction site. 5. Handling patients in healthcare settings, for example, lifting or repositioning. Question: what are the tips for reducing manual handling risks? 1. Automate tasks. Use machinery or automation to replace manual handling where possible. 2. Teamwork. Share the load with colleagues for heavy or awkward items. 3. Warm up. Stretch before performing manual handling tasks to reduce the risk of muscle strain. 4. Take breaks. Avoid prolonged manual handling to prevent fatigue. 5. Use PPE. Wear gloves, safety shoes, or back supports if required.